in iron deficiency anemia, why we get microcytic RBCs? That is the question that has been asked. The real explanation is this, that when I start teaching anemia, the first thing I tell students that always think RBC as a bag full of hemoglobin. The sole purpose RBC, the cell has been created, is to carry hemoglobin. And that's why they haven't kicked out the nucleus from the cell. Now, let's understand what happens in iron deficiency anemia. In iron deficiency anemia, you have no iron. When you don't have iron, you cannot produce heme, because iron with protoporphyrin makes it heme. Without heme, you cannot make hemoglobin, because heme plus globin makes it hemoglobin. When you cannot make enough hemoglobin, you cannot produce enough content to be put inside the bag means RBC here. So when there is not enough content to be put inside the bag size would shrink, the bag size would become smaller. Micro means small and cyte means cell. So as there is not enough hemoglobin inside the cell smaller, the cell size becomes smaller, microcytic. For the same reason, it also becomes hypochromic. Hypo means less, chromia means color. Who gives red color to the RBC? Hemoglobin, pigment. So when there is not enough hemoglobin there, the cell looks paler, less red colored. That's why it becomes hypochromic. So altogether, this is the explanation why we get microcytic hypochromic RBCs due to the iron deficiency anemia. Because there is not enough content to be put inside the bag means RBC here. So when there is not enough content to be put inside the bag appears smaller. You can think like this, that let's say you go to the school, you imagine your school days. In the school days, when you go to the school, usually on the weekdays, like Monday, your bag is fuller because there's a lot more classes are there on that section. But usually on Saturdays, your bag size shrinks because there's not much enough content to be put inside the bag, because usually there are only 3-4 classes on the Saturday happen. Understand? So you can think in that way, the analogy I'm trying to give it. So when there's not enough content to be put inside the bag size shrinks, it becomes smaller. We call it microcytic RBC. And the same reason we get hypochromic also. Hypo means less, chromia means color. And that's why there's a Chrome browser in the Google, you'll be seeing there's a multiple color, because Chrome means color actually. So hemoglobin is a pigment which gives red color to the RBC. So when there is not enough hemoglobin inside the RBC, it will look paler, less red colored. That's why it is called hypo means less, chromic means color. So altogether we get microcytic hypochromic RBC in the iron deficiency anemia. This is the whole explanation for this. Thank you so much.